everyone knows our workforce shortage, it's at dire levels. Demand has gone up, our workforce is shrinking. And so I think some of those legacy organizations are coming around more and more to be willing to embrace said solutions, but talking about working with real patients, and we need to make sure that we're vetting solutions that are high quality, have as much results as we can to get started in larger populations, and sometimes that just takes a leap of faith.
All right, welcome back to another Meeting of the Minds. We're here at the Future of Mental Health Conference in Boston, Future of Mental Health East, where there is a big focus on strategies around behavioral health and what leaders and practitioners can do to adapt to these changing times. And I'm joined by Solome Tibebu.
Thank you for having me.
Of course, from Going Digital Behavioral Health Tech. Solome has actually been involved with understanding and talking with various healthcare and digital leaders ever since she was 16 years old.
Yeah, that's about right.
For someone who has dedicated an entire life to understanding what solutions are out there to better their mental health and behavioral health, we thought it would be a good idea to come on and talk about what makes the anatomy of a digital leader. Can you talk about just what's gotten you interested in behavioral mental health tech in the first place?
Mm-hmm. Yeah, let's see. So I got into this space as an anxious teenager. I struggled a lot with anxiety and OCD as a teen. Unfortunately, it took a long time for me to even figure out what that diagnosis was. I saw 4 different mental health providers before I finally got that correct diagnosis. And so you can imagine a lot of challenges along the way, but thankfully my family even had the resources to help me connect with so many providers to do so. But something that I share often is my parents immigrating from Ethiopia and Poland respectively, they didn't even have a vocabulary for obsessive compulsive disorder when I got the diagnosis. And so you can imagine even more challenges around that. And I was the type of teen that went to the Barnes and Nobles on Friday nights reading as much about anxiety and OCD as I could. And really, as cliche as it sounds, knowledge is power. That information really helped me through what I was going through, not only to understand my conditions a little more, but to know that I wasn't completely alone in what I was dealing with. So that's when I said to myself, gee, why can't all teens everywhere get access to this kind of information? And in 2006, when I was 16, I started anxietyinteens.org, the first 14 by teen online resource, and have been in mental health tech ever since.
So, and thank you for sharing that personal story and background, because there's people that analyze markets and see profitable revenue paths and things like that. But I don't think that's nearly as powerful as having a story that you've addressed on your own.
Yeah, I mean, well, when it comes to leadership qualities for folks in the digital behavioral health space, I might be a bit biased, but yes, I think the combination of knowing your stuff as well as being able to apply your personal lived experience is a very powerful combination.
Excellent point. And when you're talking about going digital behavioral health tech, could you share a little bit of what you're focused on and some of the things that this organization does?
Mm-hmm. Yes, so Going Digital Behavioral Health Tech is the largest community focused on expanding access to mental health and substance use services through tech and innovation. Also might be the world's longest community and conference name. So now that we're going in person for the first time this year in November, there might be some name changes coming up.
Going in person?
Something a little spicier than that, hopefully. But I created this community just as COVID was setting in. I noticed that a lot of the in-person conferences were getting canceled and thought, there should be a virtual behavioral health summit, and made the leap to somehow I should be the one to organize it. But yeah, our first year, we selected a nonprofit to receive all of the proceeds of the event, which we've continued to do each year. And we had 2,500 registrants and built a lot of great community through that event. So we did it again the next year, had 4,000 people register the following year, and 5,600 people register last year. And I'm just excited to continue building the community.
So I have to say that those numbers blow my mind when you're discussing it. I'm so proud that you've been able to accomplish this for your audience. Don't you, sir? Is it basically a community of about 12,000 people, or how many people are like subscribed? And
Yes, every week we've got our weekly newsletter that goes out to over 15,000 payers, providers, startups, investors, policymakers, so on and so forth.
So gigantic pool of people that you're working with, and so happy that you're doing that within this space. What are some of the success stories that have come out of like making this information available and making this community available? What one organization or leader would you point to and think that I'm really proud that I did that because of this?
Yeah, I think it might be the collective nature of receiving the emails or connecting with people at other events, maybe months and even like years at this point later, who've said, I found my co-founder at your first event, and we connected with so many investors that ended up filling our round, and or I got a job as a result of meeting someone through the event. It's really amazing to see these stories that, had they not told me, I wouldn't have any idea about, but it's exactly what I was hoping for, that people can connect and work together to advance this entire field, and that I've been able to start to create a scalable way for people to be able to do that.
Great. Yeah, I like that. You don't come into this with a particular bias towards a certain path. This, like building this kind of community, is about raising the raising the water for everybody else too.
Absolutely. Yes.
Seeing these connections being made and seeing the success stories, people being able to raise rounds, find jobs that they need, or even make the kind of impact that they're looking for in their careers. What are some of the common traits that you see among people who've been successful down these pathways?
Well, it might be different depending on which pathway. So in terms of success in their impact and reach, or business, or specifically for those leaders,
I can only just bring my own bias to the table. I'm very interested in like the type of impact and reach that people may have had.
Well, I can speak from my own personal experience again, in that this was not my first venture. I learned a lot the first time around, and I think one thing that I'm seeing is clinicians come to our community looking to become more entrepreneurial, which I think is very exciting. We need more clinicians in leadership roles at clinical companies, the same way we need tech leaders in tech product-based companies. And I like that, at least if I can help disseminate this idea that you can dip your toe into trying novel things, and you can try, and if it doesn't fail, you can try again. That's certainly a common idea in Silicon Valley. I live in the Bay Area. There is a lot of concern that that's being applied in the behavioral health space, and I completely agree that you can't just break things and move fast in healthcare. But I hope that the pendulum doesn't swing so far the other way that legacy stakeholders feel any kind of concern around embracing novel technologies, because certainly COVID absolutely burst the door open for so many new digital, virtual solutions, different payment models for how they can be covered. And what can we do? I guess I'm more thinking, this is now a question more than a response. It's like, what can we do to de-risk or make all stakeholders feel comfortable that they could embrace novel technologies or solutions, whether it's clinicians, provider organizations, health plans, so on and so forth?
There's all kinds of different people watching this or out in the community that want to drive change from their own angles. So there are some big questions about how we make these, how we get these teams to be able to communicate to each other, have each other's language, like you'd referenced earlier on. And I know that one thing I didn't mention in your intro, but you've recently gone into a digital transformation leadership position with the Meadows Policy Institute, right?
Yes, exactly. I am officially Senior Fellow for Digital Transformation at Meadows Mental Health Policy Institute, which has been a great experience so far.
Excellent. And do they start to address some of these issues around building these gaps or building these bridges between parts of organizations?
That's actually a beautiful segue into exactly the work that I'm doing with their innovation team. Meadows is, for a long time, has been been the base, the hub for different kinds of systems, healthcare systems, justice system, education in Texas, and now even beyond. They look to Meadows for advice, solution ideas to address mental health in each of those communities. And so Meadows has, over a long time, built amazing relationships with these systems and built the trust with them. And now, how can we help guide them into this digital age to embrace high quality, scalable solutions to impact their community's mental health?
And are there any avenues of pushback that you're commonly seeing? Like, what are some of the near-term things that you're looking to address there?
Yeah, I mean, some of the typical things that you hear at many large organizations, there's the idea of change in and of itself, but also these ongoing persisting barriers in behavioral health as a whole as well, such as how our provider organization has been set up this way to utilize clinicians' time in this exact way for so long. This is a big leap to ask of them to reconsider the entire workflow and adopt an entire different care model. And so I think it's transformation of change is throughout, but it's like, how can we help them see the benefits of these scalable, novel solutions that will help extend their existing workforce? And everyone knows our workforce shortages, for example, I'll run with that. It's at dire levels. Demand has gone up, our workforce is shrinking. And so I think some of those legacy organizations are coming around more and more to be willing to embrace said solutions, but you're talking about working with real patients, and we need to make sure that we're vetting solutions that are high quality, have as much results as we can to get started in larger populations, and sometimes that just takes a leap of faith.
Well, that's some extremely exciting work, and it connects back to your earlier point on there's a broad new world out there, and there are people with that fail fast mentality, but there are others that have the stories, have the personal backing, and maybe the clinical experience to make great things happen. So, and it's a matter of finding that happy medium. Just real quick, we ask this of everyone. If there's anything that you could change, one thing that you could change about the way healthcare is delivered today, what would that be?
Right. If I had a magic wand for anything, particularly mental health, I mean, it would be amazing if we could just spring up thousands and thousands of mental health professionals overnight to be able to meet the demand of what people are facing post-COVID, especially young people. But unfortunately, that kind of workforce development, that takes years. And so in the meantime, my hope is that we can continue disseminating scalable, high-quality, tech-based solutions, oftentimes, or tech-enabled services to extend the capabilities of our existing workforce today.
Fantastic. Well, that kind of work, I know it pays off in droves, especially when we're enabling our workforce to feel better about the care that they're providing and understand that they're letting fewer people fall through the cracks. So thank you for sharing that vision, Solome. And for the people that want to learn more and hear more of these stories, how do they find you?
Behavioralhealthtech.com, or hit me up on LinkedIn or Twitter. Beware, I post a lot, but we'll have a good time.
Solome's posts are the best, and like prioritize them in your feed. Click that bell icon, and click the bell icon on us too. Subscribe, however you want to access your meeting of the minds. But again, we thank you, Solome, for joining us. We're thankful to the Future of Mental Health for providing this space for this conversation. And with that, we will see you next time.